just want, if you can just, kind of wrap up advice, or a wrap up kind of, information that is going to be a summary for whatever you have just told us, and anything that you want us as women or girls to, start doing it from day one, because you said it cannot be like we can do it everything at once. We need to prioritize and step by step, and then excessive need of anything is also not required. So we want you to give us the overall wrap up insight of this heart health information.
Sure, I would like to summarize that it is a myth that women are less affected by heart disease. Rather, they are having more complication, and the chances of getting not diagnosed properly and landing up with a heart attack are much, much more in women. And also, the risk of stroke is also much more in women. And the chances of not getting appropriate treatment are also more, and also the chances of neglecting in spite of getting diagnosed is also more in women. So I would like to give you a brief advice that it is never too early to start taking precautions. Like, as soon as the child becomes aware about other things, it should be in the curriculum. There should be some chapters which emphasize how to take care of your health, especially your heart health, because we only have one heart. We have two lungs, we have two kidneys, two eyes, but heart is only one. So once it goes wrong, then life is totally deranged. So best thing is that once a person becomes aware, like a child, so if we prevent at that time, it is known as primordial prevention. And once the risk factors start coming, like in teenage, somebody may start smoking, somebody may become obese, somebody may be having stress. So all these one by one risk factors, they creep in. So if we take control at that time, it is known as primary prevention. And later on, like sometimes the person starts having symptoms. Nowadays, even young girls in their 20s, they come to us with symptoms. So at that time, if we diagnose early, then some unconventional methods and lifestyle control can control, like you do yoga, you do music therapy, and you adopt a healthy hobby in which at least you spend half an hour to de-stress yourself, whatever you like. Like, our brain has two hemispheres, one is right and one is left. So for a right-handed person, the left is more active, like it is doing the all the skills that we acquire in our life, whatever knowledge we acquire. So the left hemisphere is active for that, and the right hemisphere, it is for the passions, like somebody likes singing, somebody likes painting, somebody likes some other activity. So most of the people, it is nowadays seen that they use only one hemisphere and the other hemisphere is neglected. So that is very dangerous. So it can cause so many lifestyle diseases. So
Right.
once you start doing this, then you can control the further progression of the disease. So we have made some performas which are available on our Cardiomerchant website also. And if required, like I can send you the QR codes for those.
Yes,
You can
sure.
share with your group. So
Sure.
if you fill that performa, then you will come to know about what risk factors you have in your life. And
Okay.
once you come to know about your own risk factors, you can control them, because most of the people, they are not aware about their own risk factors, and
Mm.
that's why they are not able to control. So once you control your risk factors, the progression of the disease can be slowed down, or you can even make it stop at that level. But sometimes, even despite all these, somebody can land up in the complications. So then what to be done? Like, suppose one has a heart attack, what to do? है ना? The first hour is the golden hour. So you should immediately rush to the place where there is a cardiac facility. But if the cardiac facility is too far, what you can do is uh, they give some injection uh, by which they can thrombolize, like the clot can be dissolved. So it will give some additional hours or additional days for you to be stabilized and then sent to the far off cardiac center. So it will not cure the disease, but it will give you extra
Okay.
time and it will stabilize a person. Otherwise, what happens that if people are referred to us with the heart attack, and if the artery is blocked and if the journey is too long, the patient can die on the way. So first we have to know that if the cardiac center is too far, best is to thrombolyze, stabilize, and then send. If it is
Yes.
nearby, you can reach within 1 hour. This is the golden hour. You can directly rush to the center. And many people they think that whenever they have a heart attack symptoms, so typically you may not have the typical pain. So any discomfort above the level of your navel, you should first rule out heart disease. And many people they treat as gas problem and take antacid. So last year I was coming in a flight from Tokyo, and a passenger, he had discomfort and he was given some medicine antacids, and he crashed. So then we had to do the
Okay.
resuscitation and revive the patient. So we were on sea, and I told them we have to land somewhere because he had a cardiac arrest, and we did a CPR. Because if you don't do a CPR within 3 to 5 minutes, the person will be brain dead. So then they told that you can divert the flight to China, so which was 3 hours away. But I was not sure whether we'll be able to get the medical facility in China immediately. So I told them, can we go to India somewhere? So they diverted the flight to Calcutta. So it was 5 hours away. So 5 hours we were trying to resuscitate the person, and when we reached, the ambulance was kept ready, and we rushed to the hospital. Artery got blocked, and artery which was blocked was opened up. So
Okay.
patient survived. So this can happen anywhere,
Hmm.
anytime. So you
Yeah.
don't have to wait for the typical symptoms. You should rush to the hospital, and then you have to decide which is best for you. Like if
Hmm.
there is a heart attack, then sometimes it can be treated by medicine. Sometimes it needs intervention. So it may need stenting. It may need a bypass surgery if the multiple vessels are blocked and left main is blocked. So you may need a bypass surgery also. So whatever is best, it is decided by the team. So team
Hmm.
of cardiologists, cardiac surgeon, and the patient, they sit together and they decide what is best. And nowadays we have robotic surgery and other forms of surgeries, non-invasive surgeries also. So we have to decide which is best, because it is not necessary that robotic will be best, because in cardiac you need a lot of precision. So I went to US in 2009 to train in robotic surgery, but the president of the robotic surgery, who himself was doing 2 surgeries in a day, they also stopped doing after 2 3 years, because the long term results were not supposed to be that bad, that good. So they also abandoned doing it. So
Hmm.
it's not necessary that all the technological advances may be good for you. So it is the
Hmm.
person who is going to do it who decides what to be done. And after the procedure is done, then rehabilitation is very important. So it is seen that most of the women, they don't come forward for the rehabilitation compared to men. Men, they do the proper rehabilitation and go back to work. For women, like, they don't come for the rehabilitation, they think that they will recover themselves. So this is also bad. So because of this, the outcome of the procedure may not be as good as it is in men. And apart from
Okay.
rehabilitation, once you are back to your work, after that also you have to take preventive measures so that the incident does not occur again. So
Okay.
that is the, we have to prevent it. Secondary or tertiary prevention is also equally important. So women must understand that
Hmm.
they have to take care of their health apart from taking care of their home and their job and their husband, their children. Taking care of their health is also important, and it is much more important. So first priority should be given to their own health, and next to the family and other things like job and all profession. So once they
Great.
start doing it, they'll be able to improve their performance at home also, and they'll be performing better at their jobs also, and
True.
they'll be having a better lifespan and a better health span. Thank you.
That's very, very, very well said, and thank you so much. There's a lot that we need to, process, and then we need to implement what you have told us. And Dr. Deepak has shared a beautiful advice that apart from looking after your family, apart from looking after your kids and husband and work, first you need to look after yourself. So he's like spot on about this thing, because if you are healthy, only then you can, run towards a healthy family. Because if you will be healthy, so will be your kids, your husband, your relatives, and so on. So first priority is your health. And again, thank you so much, Dr. Puri, for taking time out and for such an elaborative session in which you have gone beyond the details to make us feel that okay, fine, this is the way how you can prioritize, this is the way how can you put your health right in front. And we're truly grateful for this. And by
And
the way,
apart
here's
from this,
yes,
there are many, many more things because 1 hour is a very short time to
we
emphasize
would
on all the
definitely
short
have
points.
to, yeah, we would
So,
love to have you again for another episode as well, because there's a
sure.
lot
And
that we want to know more.
sure, it will be a great pleasure. And I would like to also share that we have got a YouTube channel, Dr. Deepak Puri. So there we keep on posting videos related to heart health and other control of lifestyle diseases. So few videos may be for the doctors, and few videos they are meant for the patients, and few for the general public. So you can choose the video that you would like to watch. And also like we made a small movie by the name Rakhiye Dil Ka Khayal Dil Se. So
Oh, wow.
this movie, this was nominated for 4 international film festivals also in the short film category. So it is emphasizing that why youngsters are getting heart attacks and what should be done to prevent them. So
Hmm.
it is not a lecture; it is a kind of a story, and you can watch that. And
It's there on your YouTube channel?
YouTube, yes. And
Okay, it's there.
I
Hmm.
was even awarded as a best director for that movie.
Wow.
Uh,
We would love to see that. And in fact, with your consent, I would like to share the link of your YouTube channel
Sure.
while we are going. Can I do that? Because I'm
Yeah,
sure I am also, I'm also going through Dr. Deepak's YouTube channel. It's really informative. And trust me, it's like, more than like even more than an hour, like the episodes are there, the recordings. And there's a lot that Dr. Puri has shared over there. So you can subscribe to his channel, and then you can get the instant updates and everything that has been posted regarding patient or doctor. So, and the movie that he has mentioned, we would love to watch that. And
yes.
obviously, because through movie it's kind of interactive and we connect well with that.
So
That's
this
the thing.
movie, we have made 3 like editions of this movie. Like one is the complete movie, which was almost 1 hour. So
Okay.
last year it was the 100th anniversary of Indian film star Devanand. I don't know whether you know him or
Yeah,
not.
yeah,
He
yes, we heard about it.
was
He's a legend.
born he was
Yeah.
born in Pakistan, and when like the Prime Minister of India was invited, so he was also like the Prime Minister of Pakistan. He asked the Prime Minister of India that would you like to me to bring something from for you from India? So he said yes, I would like you to bring film star Devanand with you. So
Okay.
went there and he saw the places where he had studied and where he was like living. So he was the one who was having a very healthy lifestyle, and he was working till the age of 89. So he was producing movies, writing stories, and directing the movies and acting in them. So his belief was that once we stop learning and once we stop working, that is the we are inviting old age and we are inviting our death. So he emphasized
Very
that
well
one
said.
should never stop learning and never stop working till your very last day. He used to
Great.
say that he doesn't want to become a patient and paralyzed, and people are taking care of him, nurses are taking care,
Right.
and he's on the wheelchair. So he said that kind of life is useless.
True,
So
true, true.
he we combined like his 100th anniversary, with the problem of having heart attack in young age. So he was supposed to be like people used to call him forever young. So he used
But
to walk
wow.
so fast, and I met him personally also when I was in Shimla. I was a kid that time. So I saw him shooting there, and he used to interact with people. He was very friendly, and he used to walk so fast. He used to climb uphill. Like people had to run. We had to run with him to
Wow.
match his walking,
That's great.
and
Wow.
used to take fruits and vegetables. So we used to wonder how one can survive on fruits and vegetable at that time, because we were not aware about the benefits of fruits and
Mm.
vegetables. So we combine all those things with the actual story, and
Hmm.
things about how to maintain relationships, how to remain happy, how to remain active. Because
Yeah.
nowadays people, they imitate their celebrities, and
Yes.
celebrities, if they are having a bad lifestyle, then they acquire the same bad lifestyle. Some are
Yeah.
into addiction, some are having depression, some committing suicides, and some
Hmm.
are having some criminal activities. So
Yeah.
all this should not be an inspiration to a youngster. So
True.
young girls should also take inspiration from some celebrities who have a very good lifestyle and who practically follow a healthy lifestyle. So
True.
this can help them in transforming their own lives also.
Great, great. And thank you so much, Dr. Puri, again. And as he said, don't stop learning and, don't stop working. That's the best formula to go forward. And thank you so much, everyone, for doing this and for, we are grateful for having Dr. Deepak Puri with us today for this episode, which was really insightful. And see you again with another episode. And we'll keep on empowering women with renowned, leaders and established professionals like Mr. Deepak Puri. And there's a lot that we can learn. And as he said, keep learning and just don't stop with it. So see you again with another episode. Thank you for watching us.
Thank you so much.